Most times when you go to the doctors, they're still measuring something called total cholesterol as a measure of heart disease. Now, total cholesterol is really not a very good way to predict if you're going to have heart disease. For example, 50% of people who have a heart attack have normal levels of total cholesterol. So we have to dig a bit deeper. I'm going to give you now a bullet point list of the lab tests you should be running to assess your heart disease risk. So, first things first, look at your triglycerides to HDL ratio. So, measure triglycerides, measure LDL and HDL. Then you do triglycerides to HDL ratio. This gives us information about the small, dense LDL particles that you have in your bloodstream. And the more you have these small, dense LDL particles, the more you're at risk for heart disease. So, this is actually a much better predictor. So here's the equation that you have to do. You divide the level of triglycerides in milligrams per deciliter by the HDL in milligrams per deciliter, okay? You want the result to be less than 2. If it's more than 2, it's problematic. C-reactive protein, that's another really important measure. This measures inflammation. This number should be as low as possible. It should be as close to 0 as you can possibly get it. Then your ApoB number. This is a measure of all potentially problematic fat particles in your blood. It should also be as low as possible. Calcium score should be as low as possible. Insulin resistance should also be as low as possible, as it's a big factor for heart disease. To measure insulin resistance, you want to measure the HOMA-IR ratio. And finally, just remember, your result of bad cholesterol, as in LDL, is not a very good predictor. We need to dig deeper. Now we understand way more than we did just a decade ago. So looking at just total cholesterol and LDL does not give you an accurate enough image of what's actually going on within and of your real, true heart disease risk.